Hello everyone. So today we are going to talk about familial dyslipidemias. So this table I have adapted from the USMLE Step 1 First Aid. So you can see here the various types of familial dyslipidemia. So all these types of dyslipidemia leads to the increased blood level of various lipids in our body. So there are various type of dyslipidemia. So type 1 is hyperchylomicronemia. Type 2 is familial hypercholesterolemia. Type 3 is dyslipidemia-20.9 and type 4 is hypertriglyceridemia. Let us talk about one by one each familial dyslipidemia. So now type 1 dyslipidemias, type 1 hyperchylomicronemia. It is autosomal recessive disorder. The main pathogenesis in this type of dyslipidemia is there is lipoprotein lipase or apolipoprotein C2 deficiency. So this will lead to the increased blood level of chylomicron, triglyceride and cholesterol level in the blood. And the clinical findings in the hyperchylomicronemia type 1 familial dyslipidemia is pancreatitis, hepatosplenomegaly and eruptive or pruritic xanthomas. Now let us talk about type 2 familial dyslipidemia. It is familial hypercholesterolemia. So it is autosomal dominant inheritance disorder, and the main pathogenesis is there is absent or defective low density lipid receptor or defective apolipoprotein B100. So what happens there is that in the 2A there is LDL or cholesterol level increase, and in 2B the LDL and cholesterol and VLDL level are increased in the blood. So if we divide the familial dyslipidemia, type 2 familial dyslipidemia, familial hypercholesterolemia, there is type 2A and type 2B, and in type 2A the low density lipoprotein and cholesterol level is increased, and type 2B the low density lipoprotein, cholesterol and very low density lipoprotein is increased. So the clinical finding will be the heterozygote will have the cholesterol level nearly equal to 300 mg per deciliter, and the homozygotes, which are very rare, have the cholesterol level more than or equal to 700 mg per deciliter. There will be accelerated atherosclerosis. There could be the myocardial infarction before the age of 20. There will be Achilles xanthomas, there will be tendon xanthomas, and there will be the corneal arcus. So these are the various findings we see in type 2 familial dyslipidemia. Now let us talk about type 3 familial dyslipidemias. The type 3 is dysbeta-lipoproteinemia. The disease is autosomal recessive, and there is defective apolipoprotein, which will lead to increased level of chylomicrons and very low density lipoprotein in blood. The clinical findings will be premature atherosclerosis, tuberoeruptive and palmar xanthomas. So these are the findings of type 3 familial dyslipidemias. Now let us talk about type 4 familial dyslipidemia, that is hypertriglyceridemia. It is autosomal dominant disorder. The main pathogenesis is there is hepatic overproduction of very low density lipoprotein, which will lead to increased blood level of very low density lipoprotein and triglyceride. The clinical findings will be hypertriglyceridemia. The blood level of triglyceride will be more than 1000 mg per deciliter. It can cause acute pancreatitis, and also it is related to insulin resistance. So we have discussed about various familial dyslipidemias. Again, I am going to enlist those familial dyslipidemias to you. These are the type 1 dyslipidemia, which is hyperchylomicronemia. Type 2 is familial hypercholesterolemia. Type 3 is dysbeta-lipoproteinemia, and type 4 is hypertriglyceridemia. You have to know their inheritance. Like it is autosomal recessive or autosomal disorder, you have to know the pathogenesis. And the familial dyslipidemia, what the familial, what types of familial dyslipidemia will cause the what types of increase in blood levels. Like for example, type 1 will increase the chylomicron, triglyceride and cholesterol level in the blood. And also you have to know about the clinical features of familial dyslipidemias. So I hope you understood today's explanation on familial dyslipidemia. So then this concludes our topic on this familial dyslipidemia. Thank you.